Good morning, everyone, and welcome to our weekly briefing. We will hear this week, as usual, from Public Health Madison, Dane County. We'll also be hearing from our fire department with a great update on developing a community program to provide mental and behavioral health services to residents in times of crisis. I'm very excited about this program. Before I bring up public health, though, just a reminder that this month is Women's History Month. I encourage you to tap into the resources that are available through our fantastic public libraries. They have events, reading lists, recommendations, always a good resource for learning about history. And just acknowledging that there's all sorts of women's history being made this month. In addition to having a female vice president, we've also confirmed the first Native American woman as a cabinet secretary in Deb Haaland, and that's just really groundbreaking and exciting to be continuing to make women's history this month. Also want to say Chag Sameach to anybody who celebrates Passover, which is coming up starting the 28th. I'll be having a Zoom Seder with my family. I imagine many of you will as well, but we do the best we can. And also want to note that on March 30th, it's National Doctors Day. And this might be a good year to particularly celebrate not just doctors, but all of our medical professionals who have been so essential in getting us through the pandemic over the past year. And on that note, I'm going to turn it over to Ariel Smith from Public Health Madison, Dane County for our weekly update.
Thank you, Mayor. Good morning, everyone. My name is Ariel Smith. I am the Director of Policy, Planning, and Evaluation with Public Health Madison, Dane County. Our data update for today includes that we have 41,639 individuals who have been diagnosed with COVID-19 in Dane County since the beginning of the pandemic, with only 302 individuals being diagnosed in the past week. Our 14-day average is 48.2 cases per day, and that is down from last week at our average that was 57.1 cases per day. Our percent positivity is under 1%, which is great. Hospitalizations are stable right now. We have 27 people hospitalized with COVID in Dane County. Yesterday, we shared on social media that there were only 12 people hospitalized for Dane County with COVID-19. Today, we learned that one of the health systems in our area erroneously entered 0 hospitalizations instead of 8. This brings the actual number of hospitalizations for March 23rd to 20. We have deleted the post that referenced there only being 12 hospitalizations, and you can see our hospitalizations over time on our dashboard at publichealthmdc.com/coronavirus/dashboard. Now for a vaccination update. On the matter of vaccine, as of yesterday, March 24th, 183,149 people in Dane County have received at least one dose of the vaccination. This amounts to 33.5%, or 1/3 of our total population being vaccinated. 107,557 people completed their vaccination series, which is about 19.7% of our total population. There are lots of people who are currently eligible for vaccine, and even more who became eligible this past Monday. We encourage people who are eligible to explore all options at local pharmacies, including your Walgreens or Walmarts, through Public Health Madison, Dane County, and through area healthcare providers for vaccination. Please note that some providers will vaccinate you even if you are not a patient. You can find links to these options on our website, as well as details on eligibility. Again, please visit publichealthmdc.com and click the red banner at the top of the page for more information. Please keep in mind that while vaccine supply statewide is increasing, it will take time to vaccinate all of those who are currently eligible, and we thank you for your patience. Finally, I wanted to plug some upcoming events. Earlier this month, we released the City-County Violence Prevention Roadmap. This is our comprehensive 5-year plan to addressing violence and violence patterns that we are seeing in the city and county, using science and data to better understand the violence that we are seeing. Our plan includes 5 goals and many strategies on how we can work together to prevent violence. On March 30th, 2021, from 5:30 to 7 p.m., we will be hosting a webinar to provide an overview of our plan, respond to some of the frequently asked questions we've received since its launch, and provide some opportunity for some live discussion and live question and answers. The webinar is free, but registration is required. Please visit publichealthmdc.com/VP, V as in violence, P for prevention, to find a link to register. We also have another event coming up. On April 8th at 6 p.m., we will be hosting a vaccination town hall. Join us for a conversation with local public health experts as we discuss common concerns related to differences among vaccine efficacy and provide an update about vaccine distribution processes in Dane County. We'll have Dr. Tellez Giron from UW Department of Family and Community Health and the Latino Health Council, Dr. Henderson from UW Hospital and the UW School of Medicine and Public Health, and Tess Ellens, our immunization coordinator with Public Health Madison, Dane County. There will be lots of time to ask questions. The town hall is free, but again, registration is required. Please visit PHMDC Town Hall 2 to register. There will also be a link on our website. We hope that you can join us for both of these informative events. Thank you.
Thank you, Ariel, and just want to re-emphasize that there are a lot more people that are eligible to get vaccinated now, myself included, and I will be getting my shot this afternoon. I'm very excited about that. So I really encourage you, if you are eligible, to make an appointment. Lots of options for where you can make an appointment. Check out the Public Health Madison-Dane County website for more information on that. And until you are vaccinated, and even after, please continue to take the really basic safety precautions we've been taking all along. Wear your mask, wash your hands, keep that 6-foot distance. We need to keep everybody safe until everybody can get vaccinated. All right, turning now to our crisis response program, I would like to invite Che Stedman, an Assistant Fire Chief, up to give us a briefing.
Thank you, Mayor. Good morning, everybody. My name is Che Stedman. I am the Chief Medical Officer for the City of Madison Fire Department. I'm going to be talking to you about where we're at in the planning stages with our mobile crisis response team. We've been meeting now with the Mayor's office and external stakeholders like Dane County Human Services and Journey Mental Health for the last 5 months or so, and we're actually making really good progress. And fortunately, there's a lot of good programs around the country right now that are doing very well, that we've been able to research and get a lot of good information from. So just a little bit of background for the City of Madison. You know, historically, our mental health crisis response model has been driven by law enforcement. And in 2019, the Madison Police Department estimates it received approximately 7,000 calls related to mental health crisis. And so when we research these other models around the country and research best practices, what we find is that the model found to be most patient-centered is the one that incorporates unarmed first responders and mental health providers. And just some more MPD data for you. Over the last 2 years, they've had an average of about 7,162 calls a year, which is about 19 calls a day. And it's about 4.1% of their total calls for service. And these calls in particular can take up to 3 hours at a time. So not only are we trying to get the best mental health resources to the folks that need them, but we understand that it's very likely going to take some operational stress off of the police department as well. So the objectives, we were tasked by the mayor and the council to develop a mobile crisis response team that responded to a wide range of nonviolent mental health related crises. And most importantly, we want to ensure that the medical and behavioral health care is integrated from the onset of intervention. Having a mental health professional on scene after a 911 call right away to help de-escalate and treat and refer a person is definitely best practice, rather than having possibly law enforcement or somebody else that maybe isn't trained as highly in the mental health world. And so if we can increase patient satisfaction and treatment and divert people away from emergency rooms and jails, obviously that would help the system as well, but most importantly, help the folks that really need the mental health services. So this is an alternative intervention for us. We want to have a community paramedic employed by the City of Madison Fire Department. And just so you know, we currently have a community paramedic program. We've been running for about the last 5 years, focusing on a wide range of medical issues, but we want to hire 2 more community paramedics. We're in the process of doing that right now, that will be focusing on responding to these mental health calls. But the important thing is that they're going to respond with a trained crisis worker from Journey Mental Health. And so the partnerships that we've already established with Dane County Human Services, and it's important to say that the reason the county human services are so important is because they're given the statutory authority to oversee mobile crisis response teams. That comes from the state. It's DHS 34, if any nerds out there feel like looking that up. But it's very descriptive, and we've got a lot of good resources pointing us in the right direction. And Dane County Human Services, they contract mental health services with Journey Mental Health. And so Journey Mental Health has also agreed to hire 2 more workers to help us with this endeavor. The contract language was just approved recently by the Finance Committee. We expect things to be going very well with all of the other contracts that we need. And it's important to know too that we're not just looking at just Journey Mental Health. We're looking at being able to refer to all of our community stakeholders wherever the most appropriate mental health can be provided. And of course, not just the fire department and the county and Journey are integral. We have to partner with the 911 center here in Dane County as well, because they're going to be really important in making sure that the appropriate response is sent to the appropriate call, as they already do. And they've been a great partner in our research and development of the team. So our kind of phase 1, if you will, our kind of implementation and evaluation period is going to be scaled down to a particular region in the city, and it's going to be scaled down to particular days and times. And so we do hope to get started by June of 2021, because there are other partners involved in this. We're hoping to keep on that time frame. But the reason that we're starting with Monday through Friday is because when we looked at data, that was actually the highest need time frame. And it was also from 11 a.m. to 7 p.m. And the heat map of where most of these calls were related to in the city was the central district. So it's the Isthmus of Madison and the downtown area. And this community response team is going to be based out of Madison Fire Station number 3 on Willie Street. So it'll put them in a nice central location. That is really just the distilled version of 6 months of work that we've been doing. We're doing good with hiring processes right now, and again, hope to be getting started soon. Thank you for your time. I appreciate it. Thank you, Mayor.
Thank you. I'm really excited about this work, and I want to appreciate everybody at Madison Fire, at Journey Mental Health, at Public Health Madison Dane County, and in my office and beyond, who have really hustled to put this together and done some great work. I'm really excited for the pilot and what I think we're going to be able to learn from it, and hopefully be able to push this service citywide before too long. All right, so I have a number of things to go through today, as usual, and I want to start with the American Rescue Plan. We know that the pandemic and the associated economic crisis have had a really severe impact on Wisconsin. And so the need for action, particularly on the economic front, has been really clear. Wisconsin's unemployment rate is up 4%, up from 3.3% before the pandemic. And 9% of all adults in the state report not having enough food to eat. That includes 11% of all adults living with children who report that their children do not have enough food to eat. 13% of renters are not caught up on rent, and 29% of all adults statewide report having difficulty covering their normal household expenses. This has had a really devastating impact on our state. But I'm really happy that help is here. The American Rescue Plan provides direct support to individuals, families, and businesses. Roughly 9 out of 10 adults in Wisconsin will be eligible for the economic impact payment, and that's up to $1,400 per individual, including children. The legislation also makes historic investments to safely reopen schools and increase access to childcare, both of which are critical to get our economy going again. And it enhances the child tax credit benefit to families of 1 million children in this state. Expands the earned income tax credit to benefit 300,000 workers in Wisconsin, and extends the federal unemployment insurance benefit to September 6th of 2021. There are also new federal programs to support our beloved restaurants, bars, and venues whose operations have been shuttered due to the pandemic. This plan will also help Americans stay in their homes by providing emergency aid to cover back rent, and the bill provides assistance to help struggling homeowners catch up on their mortgage payments and utility costs through the Homeowners Assistance Fund. And it provides additional funding for families and individuals who are recovering from or at risk of homelessness. This relief is not just a lifeline, it's a bridge to our future. Just one example, funding from the Federal Transit Administration will allow us to maintain the frequency of our transit service for riders who depend on it. The ability to utilize the local fiscal relief fund to address our revenue shortfalls resulting from the pandemic will enable the city to avoid costly delays and deliver our transformative infrastructure projects like our new bus rapid transit system as planned. The American Rescue Plan recognizes that cities have been on the front line of this pandemic for the past year. And it finally provides us the resources that we need to build a healthy, equitable, and prosperous future for us all. I want to thank President Biden and members of Congress, especially Congressman Pocan and Senator Baldwin, for their leadership and efforts that resulted in the passage of the American Rescue Plan. The City of Madison is grateful for the meaningful federal partnership during this critical moment in our local response and recovery. All right, I know I keep saying this, but we have an election coming up. In-person absentee voting started on Tuesday here in Madison. That's March 23rd, and it is continuing at several locations throughout the city. So if you want to vote absentee in person, you need a photo ID. And if you need to register for the first time or update your registration because of a move or a name change, you're going to also need to bring proof of residence with you. Voting is happening. I'm going to run through the locations where you can vote early absentee. I just want to reassure everybody that our election officials have been trained to follow the advice of public health when it comes to COVID-19 safety precautions. And they're being very careful to make sure that we maintain the appropriate distance and don't have too many people in a space. So you may be asked to wait outside before it's safe to come into one of the absentee voting sites. All right, so here's where you can vote early and when. At the city clerk's office, right here on Martin Luther King Jr. Boulevard in room 103, weekdays from March 23rd through April 2nd from 10 a.m. to 4:30 p.m. On Saturday, March 27th, noon to 4. And then pre-registered voters can also vote Sunday, April 3rd from noon to 4. At the following libraries: Goodman South on Park Street, Meadow Ridge on Raymond Road, and Penny Library on Cottage Grove Road, and Alicia Ashman on North High Point Road. You can vote weekdays the 23rd through April 2nd from 11 a.m. to 4:30 p.m. Saturday the 27th, noon to 4, and Saturday the 3rd, from noon to 4. Again, that's only for pre-registered voters. The Warner Park Community Recreation Center on Northport Drive is open weekdays, the 23rd through the 2nd, 10 a.m. to 4:30, Saturday the 27th, noon to 4, and Saturday the 3rd, noon to 4, also only pre-registered voters. Multiple city facilities: Goodman Park's maintenance facility on Wingra Creek Parkway, Fleet Services, our fancy new Fleet Services building at Nakusa Trail, and Olbrich Gardens on Atwood Ave are all open weekdays, the 23rd through the 2nd, 10 a.m. to 4:30 p.m. The East Madison Community Center on Straubel Court is open weekdays, the 23rd through the 2nd, from 10 a.m. to 4 p.m. 2 sites at Madison College, both the Commercial Ave campus and the Goodman South campus, are open Monday, March 29th from 10 to 2, Wednesday, March 31st from 10 to 2, and Friday the 2nd from 10 to 2. At UW-Madison, the Memorial Union site on Langdon Street is open weekdays, the 23rd through the 2nd, 11 to 4. And Edgewood, Prendlin Commons is open weekdays, the 29th through the 1st, 11 to 2. If you didn't manage to catch all of those sites as I went through, you can call the clerk's office at 608-266-4601 or email voting@cityofmadison.com or check out cityofmadison.com/clerk where you can see the full list. Really encourage people to vote. There's lots of important things on the ballot, including city council races, the state superintendent of public instruction, several county board races, lots of judges are up for election, and also very important questions on the future of city government here in Madison and advisory referenda. So please make sure that you vote, make your plan to vote, and get that done either before or on election day. Other good news, I do consider elections good news, but other good news, I want to welcome Krishna Kumar to the City of Madison and to Team City. We've appointed him as the General Manager of the Madison Water Utility, subject to approval by the Water Board and the City Council. I'm delighted to have him joining us. Previously was the General Manager of both the Marin Municipal Water Utility and the Valley of the Moon Water District in California. I think his approach and experience are going to be a great fit for Madison Water Utility, and I'm really delighted that he's accepted the offer and is interested in coming here to Madison. He will start his new position on June 1st. All right, I want to make a call for volunteers for Madison Parks for our Earth Day Challenge. For more than 20 years, Madison Parks has honored Earth Day by recruiting volunteers for this challenge. So every April, we have volunteers who help in sprucing up parks throughout the city, getting them ready for the busy summer season. And I expect that we will see a very busy summer in our parks this year, as we did last year. And even more reason that we need you for this, we canceled the event in 2020. So we're really happy that we're able to hold it this year, obviously following all of the guidance from Public Health, Madison and Dane County. But we invite you to join us on Saturday, April 24th. We are asking for advance registration, and you can do that online at the park's website or by calling 608-266-4711. We need to recruit more than 650 volunteers in over 45 parks from 10 a.m. to noon on Saturday, April 24th. Each location is provided with gloves and trash bags. The focus will be mostly on trash and debris pickup. But if you're interested in leading volunteers in a larger project, please contact Parks to learn more. We invite individuals, we invite groups, organize your friends, your neighborhood, your church, your employment, whoever you can get to come out and help our parks out on Earth Day. So please, again, register before April 21st. The event is April 24th, 10 a.m. to 12 p.m. You can call 608-266-4711. And thank you for supporting our parks. All right, I'm going to run through, as I always do, community resources, and just want to reinforce it's been a super tough year for all of us. There's no shame in asking for help when you need it. I really encourage folks to reach out when you do need help. There is lots of help available in our community for all sorts of needs. So if you are homeless or in danger of losing housing, call our housing helpline, please, at 608-264-0549 or email housinginfo@cityofmadison.com. If you need help connecting to phone or internet service, call the Public Service Commission at the state at 608-257-3595. If you need help finding a child care provider, call 608-216-7022. To identify nearby emergency food options or a whole host of other services to help you, call the United Way at 211 or text your zip code to 898-211. City is offering a free financial resource hotline to help folks navigate financial issues due to the pandemic. You can find out more and sign up at cityofmadison.com/financial hotline, or you can call our reference librarians at 608-315-5151, and they will help you get signed up. The healthcare marketplace to get health insurance is open through May 15th. If you do not have health coverage, please, please, please go to healthcare.gov and get yourself covered. If you need help navigating that marketplace and figuring out how to sign up for healthcare coverage, please call Covering Wisconsin. You can visit wiscovered.com, wiscovered.com, or call 211 and they will help you out. If you need assistance paying for your 2021 premiums through the healthcare marketplace at healthcare.gov, United Way of Dane County can potentially help you out. To find out more about eligibility or to apply, please call 211 or visit unitedwaydanecounty.org/healthconnect, and they will help you out. Now, I know that I went through a bunch of stuff that requires you to go online and have internet access, so if you need that, I want to remind folks that our libraries are offering appointments to access computers and the internet. You can call the libraries at 608-315-5151, and they will help you get signed up for a session at your local library to use the computer. All of this information and more is posted at cityofmadison.com. Click on the community resources link if you need help with anything. Also encourage people to visit and subscribe to my blog at cityofmadison.com/mayor/blog for information on the announcements that we go through in these briefings and much, much more. Finally, upcoming meetings. Today, the 25th at 5 p.m., the Disability Rights Commission will meet. At 6 p.m., the Warner Park Community Recreation Center Advisory Subcommittee will meet. On Tuesday, the 30th at 4:30, the Common Council Executive Committee meets, and at 6:30, the Common Council will meet. And then on Wednesday, the 31st at 10 a.m., the Street Use Staff Commission meets, and at 4:30 p.m., the Urban Design Commission will meet. And that is what I have for this week. So we will see now if we have questions.
Indeed, we have questions for all three individuals that spoke today.
Excellent. So we will start with public health and go from there.
Good morning, Oriel.
Morning.
So I think the question we have for you today is relatively easy.
Okay.
It says, do you anticipate with current trends in epidemiology and vaccinations, there will be a lessening of restrictions outlined in Health Order 14 prior to April 7th?
Good question. So we are always actively examining on vaccination rates, on rates of transmission, and also case counts in our community. And any opportunity that we see to either open up our restrictions or restrict them if need be, we take that opportunity, and we have a process that allows us to continually do that. So if things still look good, I think there's a good chance of that, but stay tuned and we'll be sure to let you all know.
Okay, thank you so much. That's the question we have for you today.
All right.
Good morning, Che.
Good morning.
The question I have for you is two-part.
Okay.
And it says the Madison Fire Department is interested in having 2 additional community paramedics on the team. What is the full staff available to respond to incidents? And 2, what type of training will the community paramedics specialize in compared to non-community paramedic?
Good questions, and I really didn't get a chance to go into the vision of our crisis response team. I talked about phase 1, which was the limited geographic area, limited hours of the day, limited days of the week. The vision is to go 24/7 citywide and even beyond that countywide. So right now, with the limited scope and this pilot program, we're going to have 2 City of Madison community paramedics so that one of them can be on the response team and the other one can be doing follow-ups, paperwork, and everything else. And that's the same with the Journey crisis worker. One of the 2 will be on a 40-hour work week working Monday through Friday, 11 a.m. to 7 p.m. on that response team, and the other one will be the backup. So we have 4 employees total, 2 of them responding at a time, but eventually, when we're able to go 24/7 throughout the whole county, we expect that we're going to need much more staff. Just in general, just everybody knows, on any given day we have 8 paramedic ambulances with 16 paramedics, and that is separate from our community paramedic division, right? Those ambulances are all 911 responses, but they do come across mental health issues. So all of our paramedics are trained to a certain level on dealing with mental health issues, but the community paramedics, the specific training that they get beyond is more cultural competency training, more de-escalation training, motivational interviewing, and we actually are developing a training plan from Journey Mental Health and Dane County Human Services to specifically get them more mental health first aid and more mental health training. But the important thing to remember is the community paramedic is a secondary person really in this team as far as the mental health treatment and the mental health services. They're really there mostly to take care of any possible medical issues and be able to assess the person medically, but of course also be able to de-escalate. But we're relying on the Journey mental health worker to really be the main treatment and referral provider, the triage person. So I hope that answers the question appropriately.
Thank you so much, Che. And those are the questions we have for you today.
Okay, thank you very much.
And the last question is for you, Mayor. As the number of people who are vaccinated in Dane County increases, is the city thinking about how and when to return all employees back to a pre-COVID work environment? What about city meetings? Is there a timetable for a return to meeting in person for those?
A great question, and I think we're all starting to think about what the pace of vaccination means for our community and what it means that we can start doing again or differently. Obviously, our first priority is the safety and health of our employees and of the public. We are, however, preparing now to restore some more in-person services at the city. And I just want to be super clear. We have been providing in-person services in a number of ways throughout the entire pandemic, right? So we're still picking up the trash and the recycling. Our excellent fire department is still offering all of the services, and particularly our paramedics have done amazing work, really being on the front lines of the pandemic and taking a lot of personal risk in the process. Our police department, our streets department, our park rangers, our clerk's office, all of these folks have been providing in-person services the entire time. But yes, we are looking at restoring more in-person services over the coming weeks and months. And I invite folks to stay tuned to these briefings because we plan to announce any reopening services from this podium as they become more available. We are also going to continue to allow many workers for whom it's appropriate to telework. Even post-pandemic, I think we've all discovered that teleworking is a viable option for some people in some contexts, and so we'll be continuing to offer that benefit to our employees. In terms of public meetings, I think that is on a slightly longer time horizon. The fact that we still are really emphasizing the 6-foot distance between folks not in the same household makes it complicated to have in-person public meetings and really ups the number of staff and the space that we need to make that happen practically. Nonetheless, we're working hard on options, both to return in person and also to allow continued remote participation. One of the things that has happened over the pandemic is that the option to participate in public meetings remotely has really expanded access to those meetings, and we don't want to lose that benefit. So we're trying to figure out how to keep all of the good here, and it is going to take us a little while to figure out. But both topics of much conversation and much more to come, so stay tuned on both fronts.
Thank you, Mayor, and those are the questions we have for you today.
All right. Well, thank you all again for tuning in. Thanks to Ariel and Che for being at today's briefing, and I hope everybody has a great week.